Good evening, everyone. Thanks for joining us. I think we have a great panel presentation tonight. I think between the three talks, you'll get a good perspective from all of us. You'll hear some recurring themes, but I think they'll emphasize some important points. So thanks again for joining us. I have nothing to disclose. All right, so as mentioned, I did play youth baseball. It's been a little over a decade since those days, but more recently I coached my two sons' youth baseball teams. But over the last 10 years or so, there's been a significant decrease in the number of kids that are playing youth baseball. During that same time, there's been a significant increase in the number of kids that are playing year-round. And so a lot of kids are playing in multiple teams, AAU teams, travel teams, all-star teams in the summer. So you have fewer players for more teams, and that ends up being a lot more baseball for each of the kids. Like other sports, you're seeing more competitive sports at an earlier age. You're seeing early specialization, so picking one sport and continuing to play year-round. So why are injuries on the rise? So during that same time frame, we've seen a significant increase in youth sports in general, but baseball in particular, an increase in the rate of injuries. With baseball, especially the throwing aspect with the repetitive motion, immature bones are definitely vulnerable for injury. We'll talk about that a little bit later. After a minor injury, there may be insufficient rest before returning, and that definitely increases the risk for a repeat injury. Deconditioned kids or inadequate training certainly can be a factor as well. And then again, specializing in just one sport and year-round participation in that sport. So this is a fairly comprehensive list of injuries that you might see in baseball. We're not going to talk about all of those tonight, but some are more common than others. Some are more preventable than others. The ones that are in blue there are the ones that we're going to focus on tonight. So this is a quote from Bull Durham. I'm sure most of you have seen that. So this is Skip, the manager. So describing baseball as this is a simple game. You throw the ball, you hit the ball, you catch the ball, you got it. So pretty basic, but along those lines, throwing typically is the concern is overuse injuries to the shoulder and elbow. Hitting can lead to contusions, facial injuries, strains. Catching can also cause contusions, facial injuries, hand and finger injuries, potentially concussions. Not included in the quote, but also, obviously fairly important to the game of baseball, running and sliding. So that has a separate set of injuries, strains, muscle strains from running, potential heat illness, contusions, sliding also, high risk of acute injuries like sprains, dislocations, fractures, abrasions, lacerations. So we're going to hit on most of these things. So starting with contusion, this can be from a direct blow from the ball, and this accounts for about 50% of all acute injuries in baseball. 68% of those are on defense, so getting hit by a ball that's been struck by a bat. The other potential source of contusion is a collision with another player, so that can happen during base running. It can also happen in the outfield, so two kids running after the same fly ball. So some specific considerations with contusions. So commotio cordis, which you may have heard about, is getting hit in the breastbone with a ball or another projectile. at a very specific time in the heart rhythm. This is a rare injury, but something to be aware of. If that happens at that very specific time in the rhythm, it can lead to a fatal arrhythmia. A blow to the upper abdomen on the left side where the spleen is could potentially cause a spleen injury. And then on either side, a blow to the kidney is typically followed by low back pain and blood in the urine. Could be a potential indication of a kidney injury. So how do we prevent contusions and prevent potentially these serious potential issues with contusions? So making sure that the field is safe, making sure the infield is raked out, dragged out on a regular basis, wearing proper and well-fitting protective gear. So there are chest protectors. It's controversial in terms of how much they do. Sometimes I think it's just gives the kid a false sense of security because they have not really been shown to decrease the rate of commotio cordis, which is very rare to begin with, but it can occur even with a chest protector. So I think probably more important is good coaching, coaching proper techniques, so teaching kids to dodge wild pitches, effectively being able to safely field bouncing ground balls. Safe base running rule, so teaching the obstruction rule, teaching kids how to safely run bases, avoiding head first slide in youth baseball. It's really not no good place for head first slide in youth baseball. Calling out fly balls so that you avoid the player to player collision when you're both looking up for a fly ball. I would say more important than chest protectors for commotio cordis would be training in CPR. So coaching, making sure coaches are up to date with CPR, potentially having AED available, so automatic external defibrillator. If that's not available, then just being aware of the potential of this injury and how important it is to get rapid defibrillation. So either if an AED is not available, then calling 911 sooner than later. I think also it's important, most leagues do tryouts, and I think part of that is just making sure that kids are playing at the appropriate level. It may not always be playing with other kids of the same age. You may have someone that's developed and been playing a long time and throws hard and hits hard and may be more appropriate that they're playing up with kids that are older. Okay, so moving on, sprains, dislocations, fractures, I group these all together. This is probably most common in base running and sliding. So a twisting injury, more commonly in the ankle or the knee, can result in hearing or feeling a pop, potentially the sensation that joint slipped out of place. That can happen with the patella, the kneecap. In terms of prevention, so good dynamic warm-up, again, maintaining a safe playing field, using breakaway bases. So this has dramatically reduced the incidence of foot and ankle injuries with base running and sliding. And coaching and teaching kids how to slide with proper technique, but not having kids under the age of 10 sliding. Really 10 and over is more appropriate for sliding. And then again, teaching kids the obstruction rule, so shouldn't be blocking base running path without the ball. Okay, so a word about heat illness, not as big an issue in New England as it is in some other areas of the country, but we do get some warm weeks, especially in August, and this is something to be aware of. So kids are really more susceptible to heat illness than adults. They may not have the urge or feel the need to drink enough to really prevent dehydration. And heat exhaustion can lead to heat stroke, which can be serious and even fatal. So it's certainly something to be aware of. The outcome of this is really related to how fast the body temperature comes down. So in terms of prevention, it's important with the preseason physicals being evaluated, determining risk factors, whether there's been any history of this before, encouraging players to drink enough fluids, sometimes the use of flavored Gatorade or Powerade may encourage more fluid intake, but really kind of making sure that kids, when it's hot, are drinking fluids. When it's hot and heat index is high, so heat above 90 degrees, humidity above 95%, that's really the danger zone where this is high risk. So practices really should be limited or potentially moved to a cooler part of the day. Limiting the time that catchers are in their gear, potentially having shorter practices earlier in the season when it's hot, trying to get used to that and getting used to it gradually as the season progresses. Definitely utilizing shade whenever possible, staying out of the direct sun, and then being aware of the signs and symptoms that you see in heat exhaustion. So feeling faint or dizzy, excessive sweating, and a cool, pale, clammy skin, nausea or even vomiting, rapid, weak pulse, muscle cramps. So these are all warning signs where kids really should be taken to a cooler place, drink lots of fluids, and really monitor to make sure that they're improving and not progressing. Okay, and the rest of my talk is really about throwing overuse injuries, and we'll talk initially about injuries to the shoulder. So this includes little league shoulder, rotator cuff issues like bursitis, tendonitis, partial tears, shoulder instability, and labral tears. And we're going to focus. This is really the topic of kind of a 1-hour talk that I could do by myself. So we're going to limit this to talking about little league shoulder. So this is a case, a 16-year-old pitcher presented with 2 weeks of right shoulder pain, no injury, but complained of feeling like he wasn't throwing as hard as he usually does, losing some accuracy. So these are x-rays. And I just want to point out, so this is the right shoulder, this is the contralateral left shoulder, which is asymptomatic, and this is done for comparison. This is oftentimes done with open growth plates, so young kids where you're doing a contralateral view to see what the normal growth plate looks like. And so this is on the right side, you see some widening of the growth plate here. You see it on this is a different view from above where you see some widening of the growth plate compared to the normal side. And that's the injury. So that's the problem with little league shoulder. So it's basically a stress fracture. So like this case, gradual onset of pain, kind of no one particular event, no one pitch. It's more of a gradual onset of pain localized to the shoulder region, the top of the humerus, oftentimes associated with loss of velocity or control in pitchers. Average age is 14, but basically you can see this anywhere from 10 to 16 when the growth plates are open. Causes, so poor throwing mechanics, definitely a risk factor, puts extra stress on the growth plate. Lack of strength, so both in the muscles around the scapula and the rotator cuff, so lack of strength and endurance in those muscles. Playing year-round or more than one league or team at a time, so extra throwing. Not enough rest between throwing sessions, so between games or practice or throwing sessions. And then throwing breaking balls before the growth plates are closed is definitely a risk factor. In general, too much throwing can lead to this. So treatment, basically this is rest. So pulling the kids out. Typically, this is no throwing for 2 to 3 months, which is a tough thing for a baseball player to hear. but really it's important in terms of preventing permanent damage to the growth plate. So rest until symptoms have resolved, and then basically starting the recovery process. So physical therapy to regain range of motion, strengthening, addressing mechanics to try to figure out if there are poor mechanics that were contributing to the injury. And then gradual return to throwing after the symptoms have resolved. Throwing overuse injuries in the elbow includes Little League elbow, ulnar collateral ligament injuries, which is typically slightly older patients that develop that, loose bodies within the elbow itself, ulnar neuritis, so inflammation of the ulnar nerve, and the potential of a medial epicondyle fracture. We're going to focus again on the Little League elbow. Another case, this is a younger pitcher, 10-year-old, had about 3 months of pain in the elbow and came in for evaluation. So this, I don't have the contralateral x-rays, but this shows widening of the growth plate of the medial epicondyle, and compared to the other growth plates, this is the proximal radius. You can see this growth plate is wide, and that's where the injury occurs. So the pull of the ulnar collateral ligament on that immature bone with the growth plate leads to the growth plate fracture, stress fracture. So again, repetitive throwing. With repetitive throwing, the ligaments and tendons put stress on the end of the bone where the growth plate is. This leads to inflammation of the growth plate and ultimately to the development of that stress fracture. So activity-related pain, so pain with throwing. Typically, if this goes on long enough, there's tenderness to palpation right over the growth plate, and then loss of velocity and accuracy in pitching. This typically occurs from stress in the late cocking or early acceleration phase. You're going to hear more about the throwing phases from Rob and Bill. Again, throwing breaking balls at a young age with the growth plates open, it can lead to this as well. The other infielders with typically the bent elbow throw is more of a whip throw as opposed to overhand, which can put more stress on the medial elbow and lead to this as well. So just an illustration, so ulnar collateral ligament, medial epicondyle, so the Little League elbow is the stress fracture. So older kids where the growth plate is closed would be more likely to develop issues with the ulnar collateral ligament. So much like Little League shoulder, treatment is rest until the symptoms are resolved, physical therapy for range of motion strengthening, improved mechanics, gradual return to throwing, and then prevention through proper mechanics, pitch count, adequate rest. All right, so this is a book by Dr. James Andrews. Many of you may have heard of him. He's a world famous sports medicine physician, orthopedic surgeon, who, when he wrote this book about 10 years ago, had about 40 years of experience that he was basing this on. This just as an FYI, this is a great book, not just for baseball, but for all sports. He's got chapters dedicated to injury prevention for every sport out there. So these numbers, these statistics are from when this book was written over 10 years ago. But at that time, 16 million youth baseball players, and between the ages of 9 and 15, 7 to 20% of injury rate requiring medical attention, with an annual cost of about $1.8 billion. So pretty significant injury numbers there. He's identified a number of risk factors. Strongest correlation comes from excessive pitch counts. Pitching more than 8 months out of the year increases the risk by 5 times, both shoulder and elbow injuries. More than 85 pitches in a game increases the risk factor by a factor of 4. Pitching with arm fatigue, so continue to pitch even after arm is tired, 35% increased risk. In between the ages of 9 and 14, so throwing curveballs, throwing sliders definitely increases both shoulder and elbow injuries. And then again, year-round play, multiple teams. This is a study that looked at a group of pitchers with arm injuries and looked at the characteristics. So if you 45% pitched in the league without pitch counts or limits, multiple teams, competitive baseball throwing more than 8 months a year, pitching on consecutive days, and multiple games within the same day. So as far as prevention, talks about the importance of a proper warm-up, so dynamic warm-up with stretching, importance of stopping throwing with pain, so never continuing to throw through pain. And athletes need to really communicate when they're having pain. Coaches and parents need to recognize signs of pain in case the athlete may not be forthcoming because he doesn't want to get pulled out of the game. Teaching proper mechanics at an early age, definitely very important. And then in youth baseball, focusing on accuracy, specifically with pitchers, focusing on accuracy over speed, and really not having radar guns accessible in youth baseball, just because that puts the focus on velocity. Quote out of the book, not throwing breaking balls before you shave. So this is just an indication that correlates with growth plates closing in the proximal humerus roughly. So just acknowledging that a higher risk of injury to the growth plate with the breaking balls. Keeping track of pitch counts and rest, avoiding multiple teams, especially with pitchers. And if that does occur, then certainly parents need to keep track of pitch counts and days of rest. Rotating through different positions that use different muscle groups, although pitchers should never play catcher. The one person that's throwing more than the pitcher is the catcher. Youth pitchers really should avoid showcase events because this really puts an emphasis on velocity and they do a lot of throwing in addition to the regular practice and games. The importance of cross training, and Bill's certainly going to get into this later. So other sports in the off season, or if not other sports, then doing strength and conditioning through a program like Center for Athletes. Other sports that use different muscle groups. So in other words, a pitcher that plays football in the fall and plays quarterback is not getting any arm rest. And so that's not appropriate. Time off for throwing athletes. So really 3 consecutive months off during the year, no more than 8 months a year with a throwing sport. So this is a situation where the adage no pain, no gain definitely does not apply. So should not ignore shoulder or elbow pain in a throwing athlete. So pitching with arm pain significantly increases the likelihood of getting injured. An injury or pain should be evaluated by a sports medicine provider, and they should be cleared before returning to prevent any further injury. Fatigue, so different types of fatigue. Year-round is not taking any time off or not adequate time off. Seasonal is during the season overuse for weeks or months, and then event is basically game day overuse. This is a chart of pitch count. So this is available on USA Baseball, PitchSmart website. So this is age here, daily maximum pitches by age group, and then number of days rest required depending on the pitches thrown. And this has changed over the years, but this is current and up to date. So in summary, preventing injuries, pre-participation health screening to identify risk factors. So those pre-season physicals are important. Proper maintenance of the playing field, talked about that. Paying close attention to player conditions, so both heat illness and overuse issues. Proper athletic conditioning, Bill's going to get more into this, but certainly can decrease the risk. Avoiding overuse, we talked about that. Consistent and proper use of all protective gear, making sure that the gear actually fits appropriately as well. And close coaching supervision and organization, both warm-ups, practices, and games. So it's important that these kids are supervised and that coach is aware of what's going on. And then kind of goes without saying, careful compliance with all rules that have to do with safety. Just a quick plug for Stop Sports Injuries. This is an organization that's been in effect for about a decade. The emphasis is on increasing awareness of youth sports injuries. The acronym stands for Sports Trauma and Overuse Prevention. A number of organizations that participate in this, but it's definitely worth taking a look at the website, because this applies to all sports on trying to decrease the risk of youth sport injuries. Okay, thank you. And I'm going to now pass it on to Rob Coe, who's going to talk about the physical therapy perspective.
Thank you very much, Dr. Webb. I too have no disclosures. So good evening, everyone. My name is Rob Coe. I'm a physical therapist at Wentworth-Douglass Hospital. I've been a PT since 2004, specializing in sports physical therapy. I'm originally from Canada, so like most, I've played hockey my whole life, and I have a long love affair with that game, but baseball and my Blue Jays, who I think are going to have a great season, have always piqued my interest. So this is Nash Walters. Last time I checked, he's a pitching prospect within the Milwaukee Brewers organization. The super slow motion footage allows us to really appreciate how coordinated of a movement pattern pitching is. How it requires such precise action at every joint in the body. But pitching is inherently stressful to the body, and one of the movements in sports that causes numerous injuries, like Dr. Webb had said, particularly in the upper body. If you look at the amount of torque that is generated at the shoulder and elbow, it's really no wonder that both of these joints are commonly injured and seen frequently in PT. So while pitching and throwing can cause injuries, I think if you prepare the body as much as you can really minimize that risk. I think we all agree Benjamin Franklin was a pretty smart guy. This quote, I think, perfectly summarizes what we try to instill not only in our baseball players, but in all of our athletes. We need to do what it takes to minimize risk of injuries. So what exactly does that mean? Some important components of preventing injuries before they happen: fitness, be in top physical condition, work on your strength, your flexibility, your cardiovascular fitness. Bill will go into a little bit more detail with this. A good warm-up. Dr. Webb had talked about doing a good dynamic warm-up. It does so many things to get your body prepared. It increases blood flow to the body, prepares your muscles to contract more easily during sport. Our joints loosen up and our brain starts to engage with the body and really prepares it for sport. The old adage, no pain, no gain, right, Dr. Webb? I think this has been falsely associated with athletic success. At the physiological level, pain is really an unpleasant sensation, usually caused by tissue damage. You keep hitting your thumb with a hammer. Do you keep doing it? No, stop. Pain is telling your body to react to what is causing it pain. Stop further tissue damage. We need to listen to our body. Pitch counts, we'll come back to this in a little bit. Mechanics, like Dr. Webb said, we need to find a good pitching coach. Pitching with proper mechanics reduces the stresses on your body. It doesn't eliminate them completely, but it really does minimize them. Rest, we'll talk a little bit about off days and off season in a little bit, but I also wanted to throw in here the importance of sleep. Are your kids getting the sleep that they need to allow their bodies to heal and recover from athletics? Are they eliminating electronics 1 hour prior to bed? Are they going to bed at a consistent time? Are they getting the recommended 9 to 12 hours as a school age child, or 8 to 10 hours as a teen? Sleep is really challenging for us all, but it's, you know, so vital for us to function, recover. It helps minimize injuries. I think Dr. Webb had shown this. As he said, you know, Pitch Smart, it's a partnership between USA Baseball and Major League Baseball. They came up with these pitch count recommendations. And again, they're broken down in age. The thing I wanted to say about this is pitch counts are a great thing, and they can really help decrease injury rates, but they only work if coaches and parents follow them. I think a recent survey showed that about 43% of youth baseball coaches were only able to correctly answer some questions about pitch counts. 19% of coaches allowed their players to play with known arm fatigue. We need to follow pitch counts. They really do help minimize risk. Sports specialization. We really want to delay sports specialization. You know, our adolescent and young athletes should not play a single sport for more than 8 months a year. Our kids should strive to participate in a variety of sports, really delaying specializing in a single sport for as long as possible. We're talking maybe 15 or 16 years old. You know, when they participate in various sports, it promotes better general physical fitness, athleticism. It reduces injury risks for all our kids. As Dr. Webb said, participate in only one organized sport per season, and really playing on only one team per season. The total volume of organized sport participation per season is an important risk factor for injury. So a general rule of thumb, you should play no more hours per week than your age and years. So a 12-year-old baseball player should not participate more than 12 hours per week of baseball. Kids should have a minimum of 2 days off per week from training and competition. Encourage our kids to spend time away from organized sport at the end of each competitive season. Talking about taking at least 2 to 3 months off from throwing, taking a break from baseball, it will help them in the long run. So youth who specialized the most in their sport were 81% more likely to experience an overuse injury compared to athletes who played the widest variety of sports. So interestingly, there is increasing evidence supporting that late specialization in sport, we're talking after 15 or 16 years of age, might actually lead to an actual higher likelihood of athletic success. So I think I mentioned this a little bit. Why is this? Late specialization allows our kids to sample different sports. They'll start to develop mastery of different movement patterns, and it really increases that child's overall athleticism while also reducing burnout. So we've done all the prevention that we could. We still see baseball players specifically get injured. It's a fact, all right? There are some common underlying themes that we'll see during a PT evaluation that can contribute to injuries. So when we look at the motion in the glenohumeral joint, which is the ball and socket joint of the shoulder, we can sometimes see a difference in one shoulder to the other. Throwers typically will have more external rotation in their throwing shoulder than in their compared to their non-throwing shoulder. But what we really look for in a PT evaluation is a concept known as total arc of motion. It looks at the total amount of motion from full external rotation to full internal rotation. So let's take a look at the bottom left picture here. So this person has 110 degrees of external rotation and 70 degrees of internal rotation. That total arc of motion is 180 degrees. So we're going to go over to the right side. This person now has 135 degrees of external rotation, likely somebody who throws with their right arm. Though this picture is a right arm too, but this is likely the throwing shoulder. If you look at the internal rotation, this person has 45 degrees. this total arc of motion is again 180 degrees. So when we talk about the differences between this, there is none, right? They're both equal to 180 degrees. So we don't really consider this a loss of rotation in this case. Now, if we were to see a difference of greater than 5 degrees from one shoulder to another, it can be a risk factor for shoulder pain or elbow pain. Other things that we see, I think everybody's probably heard about rotator cuff injuries. They're pretty common. The rotator cuff is a group of 4 muscles that plays a huge role in throwing. It acts to generate the rotary force of the shoulder, but it also acts as a stabilizer for the glenohumeral joint, that ball and socket joint that we've been talking about. So when we talk about the healthy shoulder, we would like to see the ratio of external rotation strength to internal rotation strength about 65%. The muscles that control or stabilize your shoulder blade are also often weak. When these muscles are weak, then the glenoid or the socket aspect of your shoulder is often unstable. It doesn't allow for that humeral head, the ball, to function correctly. I think this photo pretty much sums up what we see in PT as a whole. Overhead athletes are just like the general public, and they oftentimes have the same postural issues. Likely they're tight through the chest area, often weak in the core. What do we think? Too much time on computers and cell phones? I think that's a topic for another time. Limited thoracic spine mobility. So looking at the spine kind of in the chest area, can the spine both extend, which is bend backwards, and rotate? When my hips are facing the batter, can I rotate 90 degrees to the right for a right-handed pitcher and to the left for a left-handed pitcher? So if you don't have that motion at a certain joint, your body naturally will try to steal that motion from another joint. Most likely it's going to be the joint that's most adjacent to the joint that doesn't move. Another area that we commonly see deficiencies is in core and hip strength. To generate force and power from the lower, so much of the pitcher's velocity, is the ability to generate force and power from the lower body and core. I think as much as we think of pitching as an upper extremity action, we can't forget that the lower extremity plays a huge role. So if you can't use your legs and your core, your arm's going to pay a price. So now we're actually treating the injured baseball player. In phase 1, we really try to settle the shoulder down. We try to focus on reducing pain, managing inflammation. We're really focusing on emphasizing a good stretching program. We'll fix any existing postural issues, start to restore strength, stability, and muscular balance. Phase 2, as the athlete progresses, we're progressing with flexibility and strengthening. We're also focusing, like I said, on lower extremity and core strength. Phase 3, the athlete is feeling pretty good now. We've started to reincorporate more focus on plyometrics, higher level strengthening. Once cleared, we'll initiate a throwing program. So this is just an example of an interval throwing program. The athlete has progressed through a series of graduated throwing distances, monitoring pain and symptom provocation at each step. The real focus of this program is to gradually return motion, strength, and confidence in a throwing arm after injury. So to summarize, number 1, work with a strength coach that understands the overhead athlete. This is the prevention part. Needs of a baseball player differ than that of a soccer player and that of a hockey player. It's not the same recipe for all of them. Number 2, the same concept of using a different recipe applies to physical therapy as well. Find a sports PT that understands the needs of your overhead athlete. Number 3, this is the big one. Avoid sports specialization for as long as possible. 81%. Remember, this number is 81% of athletes who specialize are more, athletes that specialize are 81% more likely to get injured. Number 4, adhere to pitch counts and rest days. This will help minimize risk of injuries. And lastly, find a good pitching coach. Throwing with good mechanics will also help reduce injuries. But there's more. I just wanted to thank everyone for taking the time out of your busy schedules to be here today. Our next speaker is Bill Stewart. He is our Center for Athletes manager. Thank you.
Just get this in a presentation mode real quickly, but as I'm doing this, once again, thank you all for being here. I'm thrilled to be able to share a little bit more about kind of the strength and conditioning aspect with you all today. Get into this mode. Huh. Oh, there we go. Sorry about the delay there. So I am Bill Stewart. I do run the Center for Athletes. I've been there for the last 29 years at this point. I've had the honor and privilege to kind of be able to work with a wide variety of athletes there, particularly a lot of young youth baseball players, but we've had some higher end baseball players come through as well. So hopefully I can share a few of the experiences I've had with them with you during this talk. Like my previous speakers, I have nothing to disclose. One of the things I want to impress upon you, and it's been hit on a little bit by both Dr. Webb and by Rob, is your body is this complex linked kind of system. All of our joints kind of work together in cohesion to kind of produce different types of movements. Our ankles are attached to our knees and our hips and our spine and up into our shoulder girdle. And all those things kind of work in concert to try to create different movements. And just emphasizing the fact that you're really only as strong as your weakest link. If you break down in any one of those areas, it's certainly going to affect the joints, particularly the ones above and below the joint that's affected. Some of these points have already been hit on a little bit, but I want to, again, go through them with you. What causes these systems to break down? Pitching while you're fatigued is certainly the #1 cause. Throwing too many innings in a year. There's a lot of literature out there that kind of emphasizes pitch counts and whatnot, but comprehensive, or the amount of innings that kind of accumulate through the course of a year, are also important to note. And a lot of the most recent studies really indicate about 100 innings for youth baseball players. And that's really not all that much when you kind of stop and break it down. So being cognizant and aware of that is something to kind of make note of. Allowing rest or not allowing rest away from baseball. Both of the speakers spoke about trying to do multiple sports and give your body a rest in something that produces a different type of a movement pattern. So getting away from the sport a little bit. Throwing too many pitches has certainly been touched on already. But as Dr. Webb kind of alluded to, watch out for putting pitches in other positions as well, and kind of how many throws kind of collectively accumulate during the courses of practice and whatnot. He highlighted specifically the fact that you don't want to put a pitcher in a catching position. This is true for volume of pitching, but it's also true for the kind of different types of forces that a catcher puts on their shoulder from throwing from all these different awkward positions. The mechanics are not always great when they're trying to pitch or throw to second from their knees or back to the pitcher or whatnot. And also certainly consider the amount of volume that's being done in practices and in drills when you do it. Pitching on consecutive days. 2 days in a row isn't always wonderful, but 3 days in a row is certainly a no-no. Playing for multiple teams we've spoken about already. Pitching when you're injured is certainly not a great idea. When your other joints are injured, if you're having a problem with your knee or with your hip, it's really going to affect your pitching motion. So trying not to do that. ignoring proper strength and conditioning programs. I'll talk quite a bit about that towards the end of our talk here. That's certainly something that I believe strongly in. We talked about throwing pitches with curveballs and sliders at young ages, and pitching mechanics as well, making sure the pitching mechanics are solid. With this here, basically just trying to speak to the fact of looking for signs and symptoms of what's causing problems here. As a parent or as a coach, what are the signs that you can see that are happening on the field? One is certainly if you see altered mechanics while they're out there and participating. Another is if you see sort of more of a rushed throwing motion. Oftentimes they're trying to avoid a joint that's painful or sore. You have a shortened follow through. Again, that would indicate the same thing. Between innings or between outings, a lot of times you'll see a pitcher come back and kind of hold and massage a certain joint. That's certainly an indicator. If you see any sort of trembling in their hands, again, that's often a sign of pain, and that would warrant a good conversation with the pitcher. And then between assignments, just really making sure that there's not a reluctance to throw or to throw hard. If there's a number of days in between pitching assignments and you ask them to do something, a little side session, and they really don't want to do that, sometimes that indicates that they're having an issue that you need to speak on. One thing that I'd really like to talk to a little bit about is kind of what to do before you get out there and throw in general. This is something that we can talk about as far as preseason goes, but it certainly also speaks to kind of before every session. I'll touch on each one of these individually. Myofacial release is a way to try to help stretch out tissue and remove sort of tight or knotted tissue. The picture on the left, you'll see that's kind of a firm ball that he has kind of between the wall and his shoulder blade or his scapula area. And really he's just trying to work that ball and kind of roll that kind of a length of the muscle there to try to work out any tissue that might have any sort of issues. The pictures on the right-hand side, he's doing something with a roller for his forearm. The one on the left is really kind of working towards deviation of his hand to the left and to the right. So just kind of as the wrist moves one way or the other, rolling the length of your forearm against that pin will really try to help to kind of work out some of those problems and set you up for success when you get on the field. The picture on the right is speaking more to flexion and extension of the wrist. So having that wrist in that cocked up position is indicated in that picture. And again, rolling back and forth or having the hand and the wrist in more of a down position and doing the same. The next one is something called movement preparation. I'm sure many of you have seen professional pitchers doing this on the field, but really going through a series of movements to try to help loosen up the joint and prepare them for the activity that you're about to take part in. The first would be arm circles and just giant circles forward and backward, as is indicated in that picture on the left. The one right below it is just a body hug, we call them. So starting with your arms extended out at your sides at about shoulder height and just wrapping across your torso or your chest. And these movements are done relatively quickly. You're not really holding it in that hug position. You're just quickly returning it back out to your sides and then repeating that motion. For the pictures on the right-hand side, that's internal and external rotation in that 90-degree position, rotating them up, rotating them down, again, relatively quickly. And then in the bottom right-hand corner, shoulder flexion and extension is almost like an exaggerated running kind of motion with the shoulders. So lifting one arm above your shoulder height and the other one's at your hip, and then quickly exchanging them so that it's the opposite is true. Rob talked a little bit about stretching, but just emphasizing that again, here's two quick stretches that you can emphasize with your players or your kids. And one's just reaching across the body. That's going to stretch out the posterior aspect of your shoulder, your posterior capsule and all the musculature around the backside of your shoulder. You can give a little bit of overpressure with that hand in the front into the elbow and kind of press that and kind of further emphasize that stretch. And the one on the right-hand side is really working on some extension in the wrist and the elbow. And again, trying to get your forearm and those other muscles around the elbow and shoulder area loosened up. As far as specific principles, I mean, holding a good 15 to 20 seconds 3 to 4 reps on each side of the body. You wouldn't just do this with your throwing arm. It's also smart to do it with your off arm as well. You don't want to bounce kind of with that motion, but hold a good static position. And you want to work to kind of maintain range of motion with this. You're not really looking to kind of gain motion unless there's a significant deficit there. This is just trying to maintain motion through the course of the season and your session. And now that your shoulder is ready, the next kind of step in this kind of pre-participation kind of ritual would be something with tubing. The picture on the left-hand side is rapidly moving that back and forth from across your waist to that externally rotated position that you see there. The band itself is relatively light. You're not trying to really kind of work against heavy external resistance. It's just a light pressure there, but trying to move that back and forth. And then you would progress that up to kind of a high 90 position. So it's up and extended away from the body, rotating down and then rotating back up again against light resistance. Another one we like to use is more of a long arm diagonal. So you start in that extended position as you see him there in that third picture, and then you're going to bring that down and across your hip towards your opposite knee or thigh. And then the last one itself is really just to try to replicate what you're going to do on the field and to have some sort of a simulated pitching motion. So you step in with your opposite leg and bring your arm down and across, and again, warm up all of those muscles in the chain. Starting in your foot and your ankle up into your knee, your hip, and then diagonally across to your shoulder, your throwing shoulder, and then to your elbow and wrist. A couple of things to consider when you're doing strength training is it really should reflect your current ability and goal in sport. And what I mean by that is trying to make the exercise as sport specific as possible. If you're working with a baseball player, it should closely replicate baseball type movements. As far as goals and abilities, that speaks more to kind of the age of the participant. If somebody's new to lifting or new to strength training, you want to start with simple body weight types of exercises and then progress from there. And just set really simple, easy goals for them to try to attain. Moving down below, you want to train movements and not individual muscles. And that's more kind of a classic bodybuilding. You'd see somebody standing there and doing maybe a bicep curl. We really have gotten away from that in the industry, and we're trying to train gross motor movements. So chopping and rotational type movements, the type of movement you would see kind of with a baseball swing or a pitching motion. You never want to train your shoulder muscles to failure. A lot of those smaller muscles in your rotator cuff help to maintain a stable position of your shoulder to help prevent injury. If you're training those to failure, then you're really setting yourself up for problems after your session in particular. And then lastly, just like skill work on the baseball field, strength training is a long-term progression. Nothing really happens overnight. So set small incremental goals for yourself and kind of advance from there. Certainly important to have a good arm care program. And this is true not just for pitchers, but for position players as well. One thing you've heard probably about is a thrower's 10. There's lots and lots of different examples out there in the literature and online, easy to kind of find. Dr. Andrews has already been mentioned by Dr. Webb earlier, and I cite him here as well. He has a Throwers 10 program that you can easily find online. I will say this, that the Throwers 10 name itself is a little bit of a misnomer. Most of those programs are more for 16 to 20 different exercises at this point. So I'll leave you to kind of do a little research into those, but Dr. Andrews' program in particular is a good one. As far as progressive resistive exercises themselves, when it gets easy, you want to make small incremental increases. Sometimes a common mistake is these smaller muscles in the shoulder jumping from 5 to 10 pounds is a significant increase. So don't be afraid to go a pound at a time in certain instances. Another common mistake is everyone wants to use the same weight for every exercise they do. They'll use 1, 2, 3 pounds or whatever the case may be for every shoulder exercise that they're doing, and it's really not appropriate. Some are going to require a little more weight, and some are going to have to kind of modify down as well. As far as workouts themselves, a good rule of thumb is off season, maybe 2 to 3 times per week. In season, 1 to 2 times per week, and that's really going to be predicated on how often the athlete is participating. If they have a relatively light baseball schedule, a couple times a week is appropriate. If they're really kind of mired down in a lot of practice and games, a single session per week is a good way to kind of maintain strength throughout the season. And sets and reps, I usually advocate from 8 to 12 sets per rep for this age group. And really the end game is to try to create what we call a posterior dominant shoulder. So the musculature on the backside of the shoulder is really emphasized. Most shoulder programs, you're going to want to do much more pulling than pushing. And that's going to help create that. A couple of quick things about components of strength and conditioning programs. We like to do medicine ball training, a lot of plyos, some sprint and agility work, and certainly anchor it down with a strength training program. Medicine balls are a great way to kind of work with athletes. They're relatively low cost. You don't have to go real heavy with this. You know, for a younger athlete, a 4-pound medicine ball, a little bit older athlete, a 6 or an 8-pound medicine ball will be perfectly fine. A couple examples here is a chest pass into a wall, a slam down into the turf to the side and left and right, an overhead slam, or more of a rotational pull like you see in that far right picture where they're really trying to bring their hips in. What he would do is he'd be releasing that ball into the wall. And one of the things that's great about medicine balls is the fact that you can really accelerate that implement, that med ball. You don't have to stop or kind of arrest that movement when you're right at the very end range. And what I mean by that is if you're doing a bench press, you come down towards your chest, you have to pause at your chest and then pause again at the top of the movement. Oftentimes in sport, we're looking to try to accelerate through that movement and not stop at the bottom or stop at the top. So a medicine ball allows us to do that. Plyometrics are appropriate for youth athletes, but I will say that you have to really closely monitor their body. If they're having any pain or discomfort, you really need to modify what you're doing. But the type of plyometrics we're talking about, if you watch a young person out in a playground or playing with their friends, I can't replicate those sorts of forces in my training facility if they're running and jumping off these different things. So jump rope is a great way to start. Doing some jumps over a hurdle or even lines on a field, side to side or front to back work really well. Jump squats are a little bit more advanced, but making sure that they have proper landing mechanics, nice and soft, so they're flexing in their ankle, their knee, and in their hip, and that their knees aren't caving together, but a nice soft landing and then exploding up from that position. And the last one's a lateral bound or just jumping side to side. Again, the emphasis on a really soft kind of a landing with that. Sprint work or agility training, the focus is always on first step quickness. You want to try to really teach motor patterns first, and this is going to be universally good, not just for baseball, but for all sports. That has a heavy translation rate kind of across sports. And it's really easy as a coach to try to incorporate these things right into drills. This doesn't have to be something that's done outside of practice or outside of the game. So doing a kind of a side to side shuffle between a cone, and then you have to field a ball and throw to first or something along those lines. So incorporating this right directly into practice is great. And lastly, strength training itself. I always try to start with body weight exercises and make sure that those are appropriate in the form and technique or up to snuff before you advance to any sort of external weight. Simple things like push-ups and dips and squats and lunges and step-ups are going to really kind of create a simple routine and something that can be done right on a playing field with a large number of folks. It really doesn't require any equipment, and it can be done right on site, as I mentioned.